Hi, my name is Melissa. I'm going to talk to you today about weight loss surgery and how controversial it is. A lot of people are against weight loss surgery. They feel that it's an easy out for someone who's overweight. I'm going to clarify that for you today because that's a false accusation that's made by the general public about people, especially by people who do not know somebody that's gone through weight loss surgery. A doctor named Stegman in 2011 did a lot of research on weight loss surgery, and he found that over 30% of Americans are obese, and that trend is growing, and it's actually growing into our youth because now we have overweight adults raising overweight children. I had weight loss surgery in December 5th of 2011. Before my surgery, I was 268 pounds, and this was me prior to surgery. Today I'm 150 pounds, so I lost over 100 pounds. I want to go through quickly the steps of having weight loss surgery. Maybe if you understand what the person who's having the surgery has gone through, you'll realize this is not an easy process nor an easy decision for the person who's having surgery to make. Weight loss surgery is a life change. It is not, you don't just go in and have surgery because today I feel like being skinny and come out and forever you're going to be skinny. It is a way to start over. It is a way to get somebody who is going to stay on track another chance to eat right. The first process of having weight loss surgery is deciding which surgery you want to have. The first option is the banding. A lot of people know about the gastric banding. What happens is a piece goes around your stomach. This is your whole stomach. The piece goes around your stomach. It's called the band. This is now your new stomach up here. You feel full when this portion is full. Slowly it will drill down into your old stomach, and then you will go through the regular digestive process. What happens with the banding is you go every month to get the band filled. This piece here is attached under your skin to your rib cage. A needle is placed into there monthly. The vein is filled up, and the band is made tighter so that it does not stretch out. This is the least invasive surgery there is as far as weight loss surgery goes. The next surgery that a lot of people know about is the gastric bypass. The gastric bypass is the most invasive surgery there is. You have surgery not only in your stomach to make your stomach smaller, but your large intestine is cut and made smaller. So once the food goes through the stomach, there's a shorter digestive process, and you don't have as much calorie intake from that surgery. The third surgery is the one I chose, which is called the sleeve surgery. It's the newest. What happens with the sleeve surgery is 75% of your stomach is removed. You are then left with this small portion, which actually looks like a continuation of the esophagus. This is all of the stomach that I have now. Now, because this is removed, after a certain period of time, you can stretch and remake your stomach if you don't follow the diet that you are given. When the next process after you decide what surgery you're going to have is you go to a seminar. The seminar is required. You are not allowed to speak to the surgeon until after you go to the seminar. The seminar is over an hour long, and it discusses all of these surgeries in great length and the pros and cons of each one so that you can make an educated decision on what you're going to have done. After you go to the seminar, you then meet with the surgeon to get his opinion on if this is the right surgery for you based on your height, your weight, your age, and the need of what you have to have done. Each surgery has a bigger risk of losing weight. So the banding, you will lose the least amount of weight, and it takes longer to lose the weight. Whereas the sleeve, you lose a little bit more, and it happens a little quicker. And the gastric bypass, you lose the most, and happens the quickest. Then after you meet with the surgeon, you meet with a nutritionist. The nutritionist will explain to you your diet previous to surgery and your diet after surgery. Once you make this decision that you're going to have this surgery, your life-changing options start immediately. You will start eating differently, and exercise portion comes into play. This is a life change. They want to start coaching you in that change as soon as possible. So once the surgery takes place, it's a normal thing for you. After you meet with a nutritionist, you have to meet with a psychiatrist. The psychiatrist asks you many questions to make sure you don't do anything that's unhealthy that's going to make you gain weight back, as far as drinking alcohol excessively, doing marijuana, anything that's going to make you want to eat more or give you a higher calorie intake. Also, they're there to prepare for your mental state after surgery. It's very hard to realize that you're losing the weight. You see your proportion of yourself, portrayal of yourself is not what others see, and they help you get that all connected. After you meet with the psychiatrist and nutritionist and they clear you for surgery, you then go to a place called HealthTrex, which is a gym that is affiliated with the surgeon. The gym's job is to, one, do an evaluation of you to make sure that you're fit enough to go through surgery. Then they go through a whole process of training you for exercises prior to surgery. Most people that are having surgery are not physically fit. They haven't been to the gym in years, either because they're embarrassed or they don't know what to do, and because of this, they can't just go in and lift 50 pounds. They have to get on a regimen of slow amounts, repetition, and learn how to use the gym equipment. This starts before surgery. They also line you up with what you should be doing after surgery, and they give you a person to contact if you need help with that portion after. Once you're done with them, you then go and have all your pre-op done. So you have blood work done, cardio done. I had an endoscopy to make sure everything with the stomach was good. And then after that, you meet with the anesthesiologist and make sure everything's ready to go for surgery. My surgery took about 6 hours. When I came out of surgery, I had to stay in the hospital. It was supposed to be for 3 days after the surgery. I had 5 days because of allergic reaction to some medication. When I came out of surgery, I was drinking almost immediately this amount of liquid, about 3 ounces. It took me about a half an hour to drink this. It was clear liquid. I just made sure this was color so you could see the amount of liquid in this. This would be it's going to be my diet when I would go home. It was clear liquid, so we could have water, decaf tea, Jello, chicken broth, anything clear liquid, this amount. The biggest side effect of weight loss surgery is dehydration, and that continues forever. So this would be my meal, and then in between I'd be trying to drink as much water as possible to make sure I don't get dehydrated. As far as the Jello goes, this is a normal sized Jello cup that you would put in your child's lunch. This would be my portion for a week. I would take enough out to fill that cup, and that would be a meal. Also, in there, I would be drinking protein shakes, this size, but protein shakes, to make sure that I kept the protein in my system. As the process goes on, it takes months. You build up your tolerance, you stretch out your stomach, and you're allowed more food. I am at a year, so this is where I'm going to stay as far as my ounces, which is between 6 and 8 ounces, depending on if I choose to have a little snack in between or not, and also depending on the type of food I'm choosing to eat. This is a normal dinner for me. This here is 4 ounces. Normally I try to stay around 6 ounces, but the food that's in here is heavy food. I got some meatloaf and some pasta. So I probably wouldn't even need to finish this because this is heavy food, but I tend to go on the lower side when it's going to be a thicker meal. Then if it was soup, I would definitely do 8 ounces of food in there. Along with measuring every single meal, I also have to take vitamins every day. I take 1 complete regular vitamin, multivitamin. I take 1 vitamin C, 1 vitamin D, 1 vitamin B, and I also take a hair, skin, and nail vitamin because the side effect of weight loss surgery is if you get malnutrition, you will lose your hair and your nails will not be so nice. So the multivitamin has extra B12, extra collagen and other things in it to help with my hair. I go on regular checkups with the doctor, and I'm hoping that based on the broadness I gave of you today, the overview of the weight loss surgery procedure, you see this isn't easy for the person who's having it, and that It's a big life change. I exercise at least 3 times a week for 45 minutes at a time. I watch my calorie intake. I have to make sure that I have more protein than anything else, and I have to take all these vitamins, and I have to make sure I drink plenty of water. So overall, I think that the misconception that weight loss surgery is an easy means, and the notion that people get that it's something that you just walk into and say, well, I'm done. I hope that I clarified to you that that's not the case. You have to be 100 pounds overweight to have this surgery, even consider it done to you. No surgeon that does weight loss surgery will even speak to you if you're less than 100 pounds overweight. Most insurances won't cover the surgery unless you have a documented year on a well-known diet plan, either with a nutritionist, Weight Watchers, some sort of well-known diet, and that you didn't lose a significant amount of weight. If it works for you, they will not do the surgery. They will continue to tell you to follow that diet. I hope that anybody that felt that weight loss surgery is something that we should get rid of, I hope I helped shed light on the fact that I think this is something that we need. I think as a society, if we don't get these adults that are overweight under control and teach them how to eat properly, this is going to become such an epidemic that we're not going to be able to get control over it. We have children that are already overweight, that are in the grasp of almost having to have weight loss surgery themselves. They will not do weight loss surgery unless you're 16 years old or older. But we need to teach the society how to eat and what portions are so that our children do not have to go through weight loss surgery. For me, this is a successful decision. I lost over 100 pounds, and I'm happy with my decision. It's helped me learn how to eat right and about nutrition, and which is what I'm trying to help teach my daughter so she doesn't have to go through this. And I think that by taking this option away or going against this in society would be the wrong move when we're trying to build a healthier place to live.